Welcome to another series on menopause where I'll be talking about the treatment of menopause. Now, if you look at my previous videos, we spoke about understanding menopause, the symptoms of menopause, and how to diagnose menopause. Now, in terms of treatment, there are different options of treatment for menopause. You've got HRT, you've got alternatives to HRT for those people who are unable to take HRT or if they do not want to take HRT, and then you've got herbal remedies, treatments like aromatherapy, as well as other natural products that you can use to help you with menopause. But in terms of drug treatments, let's have a look at HRT. What is HRT? HRT is basically hormone replacement therapy. As you get older and you start to lose estrogen, you start experiencing symptoms of menopause such as irregular periods, hot flushes, night sweats, palpitations, joint pains, you name it. And the hormone replacement therapy is basically replacing the estrogen that has been lost in your body. Now, HRT is a treatment that was very popular in the 90s. And all of a sudden, there was this media scare back in the early 2000s because of the increased risk of breast cancers, strokes, DVTs, such as blood clots, for example. And there was a large study of tens of thousands of women, which was looking at the uses of HRT in postmenopausal women. And this had to be stopped quite early into the trials, just because during this trial, some women started having breast cancers, strokes, and blood clots. However, it was found that a lot of these risks and side effects were due to the use of synthetic estrogen and progesterone. Now, synthetic estrogen and progesterone is derived from the urine of pregnant horses and is then made into what we call conjugated equine estrogen, as well as your synthetic progesterone. However, now what we do have is what we call the body identical HRT, which is as close to your natural estrogen as much as possible. It is derived from the yam plant extracts and is thought to be much safer and lower risk than your synthetic estrogens. However, there's a new market for what we call bioidentical HRTs. So what usually happens is you have a saliva hormone test, and based on this, it is thought that they could actually try and create some estrogen that matches the individual's profile as much as possible. However, this is unregulated and this is not recommended as there's no evidence base and there's no data regarding the safety and efficacy of these products. Now, in terms of the benefits of HRT, HRT has many benefits. For example, as we mentioned, it reduces the symptoms of menopause. And a lot of women would actually find that this is one medication that's one size fits all symptoms, in the sense that it helps with most of the symptoms of menopause, as opposed to alternative drugs that might treat one or two symptoms of menopause. HRT, for example, reduces osteoporosis, which is a risk of menopause, especially in women who've had premature menopause. They're at risk of osteoporosis, which is basically thinning of the bone that can lead to fractures. HRT also reduces the risk of having a cardiovascular disease, such as heart disease, and also reduces the risk of strokes. HRT reduces your risk of dementia. HRT reduces your risk of colon cancer. And some HRT formulations can actually help reduce blood pressure. Now, in terms of the risk of HRT, this depends on the type of HRT that you're taking, and it's mainly thought that oral HRT, especially oral estrogen, tends to carry most of these risks, such as increased risk of strokes, increased risk of blood clots in the legs and lungs, increased risk of heart disease, increased risk of breast cancer. But it also has to be taken into account the family history and lifestyle, which are also factors that can contribute to increased risks apart from just HRT. Now, in terms of starting HRT, and to help you decide if HRT is something that you should be taking and what type of HRT to take, your doctor would usually ask you some questions such as what symptoms of menopause are you having, which are the predominant symptoms. There's usually a menopause symptom questionnaire that you might be asked to fill, which gives an idea of what symptoms you're having and which are the worst symptoms. They would also ask if there's any personal history, such as a previous history of breast cancer or blood clots, which might mean you cannot take oral estrogen, for instance. They would also ask you if there's any family history of blood clots or breast cancer. They would need to know at what age, did you start having menopausal symptoms. For example, are you premature menopause, are you early menopause, or are you going for the natural menopause? What would be your date of your last menstrual period, for instance? Because if you've had a period within the 12 months, you'll be classed as perimenopause. If you've had no period for the last 12 months, you'll be classed as postmenopause. And that can affect what type of HRT you should be taking. Also, in certain women who've had a hysterectomy, for instance, which means they've got no womb, and especially if the ovaries have been taken off, they might need estrogen-only HRT, for instance, as opposed to women who've had your womb and they might need both the estrogen and progesterone, because what the progesterone does, it prevents the risk of having uterine or womb cancers, which can happen with just estrogen-only HRT. In terms of side effects of HRT, the most common side effects are breakthrough bleeding, which can continue for up to 6 months. However, if this is ongoing for more than 6 months, then you will need to have further examination to find out what is causing this bleeding. Other symptoms include breast tenderness, bloating, acne, weight gain in some women, and a few women might have increased blood pressure with HRT. As I mentioned, you've got different types of HRT. You've got oral HRT, which can be in the form of oral estrogen alone or a combination of oral estrogen and progesterone. You've got what we call transdermal HRT, which can be found in the form of gels, patches, sprays, and implant. And then you've also got transvaginal, HRT, which are usually for people going through kind of vaginal or bladder symptoms. And they also come in the form of gels, creams, and pessaries, as well as sprays, especially in America. Now, what type of HRT preparation you have, as I mentioned, will be down to your age, if you're under the age of 50 or over the age of 50, if you have any risks, such as, for example, if you've got gallbladder or liver disease, or your BMI is over the age of 30, it is recommended you should have the transdermal HRT over the oral HRT, just because there are slightly increased risks with oral HRT. If you're under the age of 50 and you're still having periods but you have menopausal symptoms, then you'll be given a type of HRT where basically you're expected to have a regular bleed while you're on the HRT. However, if you're over the age of 50, you've had no period for the last 12 months, you'll be given what we call a continuous combined HRT, where you're not expected to have any bleeding after 6 months of using HRT. So if we look at the vaginal and bladder symptoms of HRT, as I explained in my previous video, a lot of women experience symptoms of vaginal dryness, pain during intercourse, or bleeding during intercourse, and reduced sexual libido as well. And this can also affect your mood, leading to problems during a relationship. So in terms of treatment, you've got the option of lubricants, moisturizers, as well as vaginal estrogen. Now, lubricants are useful, which is something you can have during sexual intercourse. Moisturizers help to keep the vagina moist, and that's something that you can apply every day, regardless of having intercourse or not. However, a lot of these women find that this offers short-term relief and doesn't actually do the job of replenishing the vagina's tissue, which has now become thin and dry because lack of estrogen, and that's where vaginal estrogens come in. And what these vaginal estrogens do is they help to increase the blood flow back to the vagina, which means that the vaginal tissues are now hydrated, and it can come in different forms such as your tablets, gels, creams, or sprays. And these vaginal estrogens are usually used alongside your oral or transdermal HRTs, because oral or transdermal HRTs by themselves are not sufficient to help with the bladder or vaginal symptoms you have with HRT. I mean, there are a multitude of lubricants or moisturizers in the market. However, it's advisable that you should speak to your pharmacist or doctor before deciding which to go for, as some of these can contain chemicals like parabens or propylene glycol, for instance, which can cause irritation of the vaginal tissues. Also, with vaginal estrogens, there used to be a fear regarding the risk of womb cancer, for example. However, studies have shown that there is no evidence for long-term use of vaginal estrogens that can cause uterine cancer. So it is advised that you can use vaginal estrogens for as long as necessary. Now, in some women who have reduced sexual libido, it is also found that these women are lacking testosterone, the male hormone, and this is usually found on blood testing. Now, the male hormone testosterone is also produced by the ovaries. However, this is produced in small amounts, and the amount of estrogen usually suppresses the effects of testosterone. So testosterone can be used in the form of gel, spray, or implants. And again, they help with the symptoms of reduced sexual drive, fatigue, but it can have side effects of acne, deepening of your male voice, and hairy growth in unwanted areas. So this is something you have to carefully consider. So another option would be maybe trying a different type of HRT preparation before you consider going on testosterone. So in a nutshell, this is basically a quick summary of HRT treatments. I hope you found this useful, and you can feel free to check out my other videos on menopause treatments.